Okay, so next, manual muscle strength testing. We're going to using the MRC 0 to 5 scale. 0 means paralysis, 1 means you see some movement but only at the muscle. 2, there will be a little, some movement but not a full range of movement. 3 will be a full range of movement. 4, full range of movement and some resistance. 5, normal, and often you want to compare with the normal side. So let's start off with the thumb. When using the thumb, the abductor pollicis brevis, there's more than one muscle involved in the abduction of the thumb. So you ask the patient to move the thumb towards the ceiling, hold it in that position. You can see you can hold it, so it must be at least a 3. And then you press at the MCP level down and ask the patient to resist this movement. As you notice, I'm holding the wrist into extension, and he's only able to move the thumb in that direction. Using measuring the opposition, you ask the patient to hold the thumb in this position, hold it, and then you press at this level, again at the MCP joint, but in line with the palm of the hand. Hold it, hold it, hold it, and relax. And for flexor pollicis brevis, you again ask the patient to hold the thumb in this position, and you give resistance towards flexion of the MCP joint. Here, and relax. Very good. Okay, for the hypothenar, you're holding 3 fingers. You watch that this is full range of movement. You ask the patient to hold the little finger in that position, hold it. You see there's no movement, so it must be a 3 or more. You press at the PAP level to check if it's a 3, 4, or a 5. Very good. Then we turn the hand around in pronation. The first dorsal interosseous, you're holding in 3 fingers. You check for what the passive range of movement is. You say, okay, hold it in that position, hold it. You see he is able to maintain the finger in that position, so it must be a 3 or more. You see a good activity of the first dorsal. You press at the PAP level to check for 3, 4, 5. If you want to measure all intrinsics in one test, you can do it in this way, in intrinsic plus position. You ask the patient to hold the finger in flexion MCP and extended PIP, and then you press at the PIP level. And so you have the dorsal and the palm interosseous and the lumbrical in the same way. And you can measure all the fingers independently. So go back to the extrinsics. You ask the patient to flex the fingers, hold it, flex as hard as you can, and then you try to extend the DAP joints. Hold it, flex, 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 and you try to extend the DAP joints. For the flexor digitorum profundus, when you go to the superficials, you're holding 2 fingers and are measuring the middle finger, flex, yes, flex, and so you can see there's no flexion of the DAP joint, there's no profundus activity, so there's only, hold it in that position, hold it, and so you can measure the FDS, the superficial flexor, in isolation. Testing the extensor digitorum communis, you're testing the MCP extension. You relax the fingers and only hold the fingers up in that position, very good. And then you press towards flexion of MCP for the extensor digitorum communis. When you're testing extensor carpi radialis longus and brevis, difficult to separate, you will ask the patient to hold the wrist in extension. Fingers can be relaxed, and you press at the 3rd and the 2nd metacarpal. Hold it, and relax. And for extensor carpi ulnaris, it will be a little bit more towards the ulnar side. Hold it, and relax. Very good. Flexor carpi radialis. You ask the patient to keep the hand up. Relax the fingers. Hold it. For flexor carpi radialis, you press it about the 2nd and 3rd metacarpal. For the flexor carpi ulnaris, at the 4th and the 5th. And relax. Flexor pollicis longus. Flex the IP, and you check for the strength of the flexor pollicis longus. For extensor pollicis longus, you ask the patient to lift the thumb, hold it, and relax. And that's it.